Go for it, Soteria.
Good evening. My name is Soteria Cobb, the Membership Director for the San Bernardino County Medical Society, and I'd like to welcome you to tonight's webinar presentation on new staffing solutions for your practice, presented by our one and only Dr. Rios with Outpatient Call Solutions. Outpatient Call Solutions is not only a valuable premier business partner with our medical society, but also an expert in the field of streamlining medical staffing protocols and processes, improving patient relationships, and increasing revenue for medical practices. This webinar is being recorded, and during the presentation, we invite you to submit any questions by clicking the chat in the control panel visible on your screen. And to make this a little bit more interactive, you can raise your hand, which could be found under the reactions. We appreciate if you please keep yourself muted during the presentation. Now I'd like to introduce you to our presenter, Dr. Rios. Dr. Rios has been practicing in the Inland Empire since 1997. His primary focus has been serving the underprivileged communities and improve the quality of life for his patients. He has 11 clinics that offer family practice, pediatrics, geriatrics, HIV specialists, podiatrists, urologists, OBGYN, mental health, and 30 providers in total. Dr. Rios is the funder of 2 independent physicians association, a medical call center, and a medical management company that serve other practices in California, Arizona, and Texas. Dr. Rios employs 500 staff members. Dr. Rios graduated from the Medical School of Metropolitan University in Mexico City and completed his family medicine residency program at Martin Luther King Hospital with the UCLA Drew University in Los Angeles, California. So now I'd like to turn this over to Dr. Rios.
Thank you, Soteria. I'm going to make this short and sweet because I know everybody wants to go out for dinner. So I like to start telling you my story and see and understand what is this coming from. So like Soteria say, I am a family practice physician. I started working in Riverside, California in 1996. And then I served really 70% of our patients, Medicaid patients. And I really noticed that one of the main problems that we have was this busy practice that requires a strong staffing support. So I always had this issue with staffing for multiple reasons, either human resources or absentees, so there was something every day. So I decided to start looking for a outsourcing service or remote staffing. And I look around, there are several call centers in the country, like McKesson and many other countries outside the country, many other call centers outside the country. There were many problems. Number one is that they were too expensive. Number two, the service was really poor, and the employees that they were for the assigned clients, which was me, had a poor training. So I had a lot of complaints. So I decided to build my own call center, and then so this happened about 5 years ago, and I built this call center with only 6 employees, and I tell you that this was the best investment I ever done in my life. It created significant improvement in my practice. And today we are about 300 employees, and 100 of them are assigned to other practices that are not my business. We offer services in Texas, California, Arizona, and we're expanding every day. So we're planning to bring another 200 more agents to serve more practices around the country. And I noticed that the main benefit of this investment is that we save money, we decrease HR issues, our patient satisfaction increase, and our patients and our practice productivity definitely increase. So I have this website that I just want to present to you in a simple way so you understand what we do. The call center is really not a call center. It's more like a remote staffing outsourcing service. It, like I say, has multiple benefits: increase profits, increase patient satisfaction, decrease your liability, especially in HR, and we are database secure and HIPAA compliant. So the benefits are multiples. We have call center by itself. So we have remote people that will pick up the calls at your office in our call center and will follow the protocols and policies of your practice to handle the calls. Like if a patient needs an appointment or patient needs some instructions. The call center also do outbound calls. Like if a patient needs to be reminded to come to their appointments or some specific instructions. Many times, many clients use these call center services for marketing campaigns. So the call center by itself is just a brief portion of our company, of our operation, but it's probably the most important because that's what most people need. We also have referral coordinators, which is a major expense for practices that are primary care physicians. We, in the state of California, are required by health insurance to make sure that the patient is referred. We get calls from our health plans like IHP and Molina to make sure that we are in compliance with the referral coordination of their patients. So this is something that we as business owners need to do this expense, and it's necessary for our patients, but there is no financial benefit for us to pay somebody to do the referral coordinators. So we have this referral coordinator staff in our call center that will generate the referral coordination, will call the specialists, they will get authorization from the health insurance, and then they make the appointment for the patient. And when the result is back, the call center, or the referral coordinator will be able to schedule to put together the report and the electronic medical records so the physician can review it. We also have billings, codings, collections departments. This is nothing new. There are many call centers around the world that do this billing, coding, and collections. India, Philippines, and many other countries have these remote billers, coders, and collection departments. And we also do the same. We have a few clients that use our call center for billing. Altogether, we have about 30 agents doing billing and coding. Some of them are certified coders. They can take their coding certification online, so they know exactly that this is a peace of mind for the client that we are dealing with educated people on how to do the billing. We also have digital conversion. This is for practices that have a paper and they want to convert their paper to an EMR. So we help them. We transport those medical records and paper to our call center, and then we do the conversion there. We also have surgery schedulers. We have several surgical teams and groups that use our call center. This is highly complicated, but it's very beneficial for the practices because, first of all, it's a lot less expensive than having a surgical coordinator here. And second is that they are only concentrated on this department. So it's not like a front office trying to pick up the phone and do the surgery schedule. This is only dedicated people that do that. And the way they do it is that they get the referral from the physician, they call the hospital, they get the authorization from the insurance, they get the first assistant for the surgical procedure, they get the pre-ops, they make sure that the patient has all the lab work necessary for the surgery, and they schedule the surgery according to the surgeon's work schedule. This is one that really I'm very proud of it. And the other one is quality improvement. And the quality improvement, we do a lot of things. We help providers to reach the STAR measures. We do a lot of calls for our patients to come for the mammograms. I know that IHP and Molina are paying P4P, so payments for performance. So many of us don't have the time to call our patients to come for the mammograms or anything that is a STAR measure or quality of care. So, and for this reason, the providers do not reach their goals, and they also don't reach the P4P payment. But with our assistance, we can make sure that your practice is getting all these payments, because we make these appointments for mammograms, colonoscopies, the A1Cs, or whatever is necessary for the patient. In our practice, we are reaching 4.5 stars for IHP, and for our Medicare patients, we are at 5 stars IPA. And then finally, we have our healthcare coaches, which is a little more complex and it requires more expertise. So we have medical students that help us with our patients and our charts to make sure that the patient is getting the proper treatment that we are supposed to give to the patients. So basically what they do is that they review the chart and they find gaps that are missing in the chart. So if I see a patient and I didn't order the colonoscopy and the patient is required to have a colonoscopy, the healthcare coach will send me an email, say this patient needs a colonoscopy, and then I approve it and they can order it. So this is only few of the functions that we have, because I don't want to make it too complicated, but in reality, we have an average of 23 different services that we offer in our call center. And obviously, we have an association with, or relationship with, the San Bernardino Medical Association, Riverside Medical Associations. We're accredited by the BBB, and we just passed our HIPAA certification with this company that is called HIPAA Verified. Our group, actually our facilities are 24/7 guarded, and we're in compliance with every HIPAA requirement that is necessary to practice. So this is a brief explanation, and I like to stop right here because I know that some of you may have some questions, and I can hear it. I see two doctors, Dr. Deepak.
Yes, Dr. Sheff, do you have any questions?
You're on mute.
Dr. Rios?
Yeah.
I've got a question for you. Can you give us a little bit of information on, kind of practices that the pain points that they have in that staffing area that OCS could probably help a lot and take some headache away? We know staffing is such a big problem right now in medical practices, and so I'm just wondering if you could kind of give us some idea of what does that look like exactly? What kind of problems are out there that they would turn to you?
Can you repeat it again? It's like I don't hear you very well.
Oh, no problem. Can you hear me now?
Yeah, much better.
Okay. So here's what I was thinking. I wanted to understand a little bit, maybe an example of how a physician's practice would be, just in a pain point with staffing. It's a big problem right now all over the place in medical practices. And so I'm wondering, can you give us some kind of an idea why somebody would choose you, and what would be a scenario that would make them want to kind of outsource this stuff, call center and scheduling and things like that? Why would somebody choose to do that?
So the main reason is that the practice will delegate all the HR problems to us. So let's say that the practice needs a referral coordinator. So we will find an agent that will do the referral coordination for this practice. And then the the practice or the doctor is not going to be supervising this referral coordinator anymore, because we are going to have people that are going to be supervising that the work is done. And I have here my client's general manager. His name is Omar, and he can explain a little more about how this works. How do we supervise and how we avoid problems to the practice? Can you please tell us more about it, Omar?
Yes, of course. So what Dr. Rios has mentioned is it's a very important point, because what we do is that once we get the staff in, because we get the training from the client and then we train our staff, we have a whole team of that is part of the management. We have the training department, we have supervision department, and we also have the quality assurance department. So between these three teams, we make sure that the things get done correctly, and that every day or every daily activity is supervised well, and also that we're making sure that everything's being done correctly. So between the training department, supervision department, quality assurance, they always get feedback, and they're always in communication to make sure that everything's being done correctly, and take action whenever we find that there's something that needs to be improved.
Oh, wow. That's okay. That's a good example. And then can I just ask another follow-up question? So I wanted to know, a practice that is really busy and is doing, answering the phones, trying to see patients, checking out patients, things like that. Is this, I would think that this would be a really great solution for folks that perhaps just want to get that phone situation taken care of so that we can have more employee productivity time. Would that be fair to say, or?
Yeah, that's exactly the purpose of this service and the reason why we have so many clients and we're in such great demand, because we can make the practice much more productive, concentrated on what is important, dealing with the patient that is in the office. So I am going to show you this other, am I showing my screen? Yeah, share screen. So can you see my screen here? Can you see my screen here?
Yes.
Okay, so these are some of the services that we offer and the prices. So you can see that an inbound and outbound call agent will cost $14.50 per hour. And that's it. We don't charge anything else. So there are no extra benefits, no other expenses. So the practice will end up saving money just hiring this person. But well, there is another referral coordinator here that will pay $15.50 per hour. But that doesn't mean that that person can be just concentrated on this job. We can have one agent doing 1, 2, or 3, or 4 different tasks, just like a front office in any practice. So
okay, I like this. And so this is very transparent of you to put your prices up here. So we appreciate that for sure. And then I wanted to say though, so let's just say that our practice would want an inbound and outbound call. So would that just be one person? We're only paying $14.50, or how do we determine how many of those employees that we would, that we would need from on your side? Because $14.50 is per person for, let's say, the inbound, outbound calls.
Yes. So we need to understand what is the situation of the practice.
Got it.
So if the practice have 3 or 4 doctors, maybe that practice need 2 or 3 front office inbound, outbound agents. But if the practice has only 1 doctor, one probably can do the job. And sometimes maybe 1 is too much. So what they do is that they use this option of getting one agent for this position 50% of the time, but the other 50% of the time can do other things, like coordinator.
Kind of like you can mix and match.
And we call it the hybrid agent.
Awesome. Okay, this is interesting. Thank you, Dr. Rios.
So, but at the end of the day, we need to understand what is the practice needs. So if any one of the participants are interested to tell us what the practice needs are, then we can give you an idea of how can we provide some services to you. But before you speak, I want to say that we usually have a 30 days free cancellation. So if for any reason, any one of the practices do not like these services because it's just not something that they want, we can always cancel it. So it's really very low risk. And then in my experience, really 99% of the time, all our clients are happy, and we can provide names as a reference so you can call our clients. I mean, if you call me, I will tell you that it's really good, but I think it's fair that you call somebody else too. So any one of the people in the meeting are interested to tell us more about their practices? I just see phone numbers.
Yeah. I think people are shy tonight.
Dr. Shed, are you shy today? We cannot listen. It looks like you are in mute. There you are.
No, I'm just thinking.
He's just reflecting.
Okay.
Okay, wonderful. Well, Dr. Rios, I have a question then, and Mitzi, thanks for kind of getting us started on kind of talking through some of this stuff. How do you, can you give us an example of how someone's, revenue might be, there might be streamlined or the process might be enhanced? I mean, obviously by being more efficient, with the way that they, process and do intake on some of these things is going to make a huge difference. But do you have any examples of some success stories of how this has worked maybe for some practices?
Yeah, of course. We have a contract with a group that is called California Eye. It's a very large group of ophthalmologists. Okay. Everybody knows them in Southern California. They are like maybe 100 ophthalmologists, and they use our call center.
I see.
They were a little reluctant when they start. So they start only with one employee. So then after they saw that the service was really superior, then they start hiring more and more agents. So right now we have something like 20 agents. Is that correct, Nelva?
It's 44, Dr. Rios, with California.
Yeah, 44 agents that work only for this client. And then we provide lots of different services, inbounds, referral coordinators, and many other things. And so the secret of the success is training. So if the provider is going to give us the proper training, which Omar will walk them so they can give us the proper policies and procedures and then and all the different needs that the practice has, then for sure it's going to be a successful relationship, which is true for 99% of the time. And then we help them a lot to create those policies and procedures, because every practice is different, right? So the referral coordinator for ophthalmologists is not the same thing that what for a cardiologist is. So we need to understand the practice. But one thing you need to know is that we do nothing but just medical. So we have a pretty good understanding because we run our own practice and many others, that this kind of business is unique. So you need to have people that know how this goes. It's like when you hire a front office for an ophthalmologist, Well, when she started working in the ophthalmologist, then she needs to learn how the ophthalmologist business is. But if that person goes to work with another specialty like cardiologist, then she needs to learn how the cardiology business is. But that person has pretty good idea of how the business and healthcare works. So the bottom line is that we do nothing but healthcare or medicals. We have clients for primary care physicians. We have specialties like ophthalmologists, cardiologists. We even have health plans that use our call center for reaching out to their members.
Oh, wow. Okay. Well, that's really good to know. I think a practice would, obviously, it could be very transformational for a practice, and sometimes it's just a matter of, it's difficult sometimes, and this because you live it every day, but sometimes it takes a little while to influence a practice to maybe change the way they're doing things. And that's how we all are. It's human nature. But I think that, sometimes getting them to understand that this is really going to be of tremendous benefit. And it's worth making some changes. Everyone will be happier in the long run and much more productive and successful. I mean, let's face it, we can't do anything if we're not successful in terms of our work output and financially. And this will accomplish all of that.
Yeah, and just to add a little more about what you say is that doctors are not making more money. Doctors are making less money every year.
That's so true. Especially with all the attacks on Medicare cuts and on Medi-Cal being, held steady and all of that.
So we need to find a way how to survive, especially small practices or medium-sized practices, because these huge companies like Kaiser and all these healthcare organizations are the ones who are able to survive because they receive all this income and they're sustainable. But small practices, they have a rough time trying to survive. And we like to offer service to our patients, but the cost is sometimes impossible to sustain.
Yeah, it really is, and the beauty of what you're offering to it allows them to be more efficient without detracting from the quality of care, which when you have a lot of these, and we have to, I know practices have to look at efficiency of scale and things like that, but a lot of times when you have those things going on, it's impacting the care, with some of the mergers and things going on. And we all know about the corporatization of medicine. The CMA obviously is very involved in looking at that and trying to provide relief for doctors. But what you're doing is giving physicians and practices a way to address the way that they can be productive without taking away from the quality of care.
Yeah, and finally, I want to say that healthcare is the most regulated industry in the United States. And we haven't finished. We have more and more paperwork to do. So doctors end up getting really burned with so much administration that it's impossible to survive. So the young millennials don't want to have new practices. They just want to work for a company. And
exactly.
Because the kind of work that we have to do is just tremendous.
Yeah, that's so true. There does seem to be kind of that mindset creeping in a little bit. Yeah. They have to be a little older, like all of us.
That's right.
Yeah, exactly. Well, this is phenomenal. If someone on the line with us who is just kind of listening and thinking about this would like to reach out and talk to you maybe about partnering and things they can do, can they just contact you directly?
So they can they can call me direct. You can always give
or
me
your
my
office, call Virginia or
I'm a public figure. Everybody knows my phone number.
Yeah, it's hard to hide from that. when it
No,
gets
I'm
so
not. Yeah.
stuff. Yeah.
But yeah, the emails and the website is here. It's
Okay.
outpatientcallsolutions.com.
Okay.
Or they can call Virginia or anybody, you know, Miss.
Yeah, wonderful. And you guys, anyone listening too, you're welcome to call us at the Medical Society. And of course, we'll get you connected over with Dr. Rios and his team. So I don't know if anyone else is feeling unshy and wants to say anything before the chance passes you by, but this was really eye-opening. And I agree with Mitzi. It is very transparent of you to have shared your price points. I mean, that's huge, and it's clearly very reasonable. So thank you for doing that.
Well, thank you, everyone.
Yes, thank you so much. This was nice.
Thank you so much, Dr. Rios and Nova and Omar, and we appreciate your time so much, all of you.
Bye-bye now.
All right. Have a
Okay.
good night. Thank you.